don't mind, you just started recording, so thank you. So what I'll go ahead and do, since we're just now right at 1 o'clock, I've got 2 minutes after, to see if any other individuals join us. I'll go ahead and start with the introductions and presentations for the meeting. My name is Dr. Dominic Zerlo, and I am with the New Mexico Department of Health. I'm the director for the Medical Cannabis Program Division. My pronouns are he and him, and I prefer to be called Dominic. So through the course of this, my first name is completely appropriate. With that, I'd like to go around and just have everybody who is on the call so far introduce themselves. I'm going to start with some of the medical cannabis program staff, just so that are on as panelists, and Department of Health staff, in the event we have additional committee members join. So Dr. French, would you go ahead and introduce yourself and how you prefer to be addressed?
Yes, I'm Dr. Gary French. Just call me Gary, pronouns he or him. And I've been with the medical cannabis program since 2020, just before COVID began. And it's been a great process, a great evolution here in the medical cannabis program. And with the CRA and this committee here, we're going into the future, into this, all the nuance and the new things that we're going to see here with cannabis in our society here. So thank you all for being here, and this is exciting. So.
And before we move forward, just in case, CRA stands for Cannabis Regulation Act. So. Which was passed in the special session of 2021 and actually created this particular council committee. So thank you, Gary. Libby, would you introduce yourself?
Hello, everybody. My name is Elizabeth Bissio. You can call me Libby. I am with the Department of Health. I am the health educator for the medical cannabis program. I have been with the program for about 3 years. And I'm kind of the one who does all of our meeting stuff. So if you have any issues or need any help, I can help troubleshoot with that. At times the updates will come from my personal, not my personal, but my work email rather than just WebEx. So just wanted to give you a heads up on that. And thank you all for being here.
Thank you, Libby. Chris Woodward, would you introduce yourself?
Sure. My name is Chris Woodward. I'm an attorney with the Department of Health, and I work with the cannabis program. I've been here at DOH for 15 years now, and of that, I think close to 12 years of that has been spent working with MCP. So quite a while, and just happy to be here.
Great. Thank you, Chris. And so at this point, we have had a couple of other individuals join us. We're just going through and doing introductions, and please just, if you don't mind, letting the group know how you prefer to be called. So for example, even though I'm Dr. Dominic Zerlo, I prefer Dominic through these meetings and use he and him pronouns. So why don't we go ahead and start? Let's see. So we've got Dr. Alan Plymall. Will you go ahead and introduce yourself, sir?
Hi, I'm Alan Plymall, a lifelong New Mexican, educated in Albuquerque and living in Deming for the past 48 years. I practice 2 days a week at an internal medicine clinic. As being able to only work 2 days a week gives me a lot of pleasure in being on the committee. And I'm excited about this committee and being in the forefront to see how cannabis is going to affect our state going forward. Thank you.
Thank you, Alan.
And I'm Alan.
Thank you, Alan. And Dr. Hallie Faust?
So I was originally a primary care physician and preventive medicine public health physician, and started my career teaching epidemiology at the University of Michigan, and I've taught it at a number of other universities over the years. Eventually, I went into healthcare management and ran HMOs and was the medical director at Aetna for some time. So for you practicing physicians, you may automatically hate me, but I hope not. I hope you'll get to know me before you decide that. In any event, I ended up being the head of their strategic investment unit and then moving into venture capital. And for the last 30 years, I've been a biotech venture capitalist. One of the companies I actually looked at starting, we ended up not doing it, but was working with a pharmacologist at the University of Connecticut who was an expert on cannabis or cannabinoids. And but that was about 15 or 20 years ago, so I can't say that I'm up to date on all the medical information on cannabinoids since then, but it was real interesting to get to know it. The other side of me is I'm a bioethicist. I have a philosophy degree and have done a fellowship at the University of Toronto Bioethics Center, and very much enjoy engaging in the philosophical questions that are. Look forward to what this committee is going to do and how I might be able to contribute.
Okay. And how do you prefer to be addressed?
Oh, Hallie is fine.
Okay.
I'm used to people calling me anything. So, that's fine.
Okay, great. Thank you, Hallie. And so Ryan Nix, can you go ahead and introduce yourself?
Sure. My name's Ryan Nix. I've actually lived in New Mexico since 2018. I'm serving as the executive director of an agency that provides services for people living with HIV. We do harm reduction services as well, train individuals using naloxone, and then we offer a lot of housing programs. So we provide housing for individuals living with HIV, people with mental health issues, and just individuals that are losing their housing are currently homeless. So we provide housing pretty much south of I-40 for New Mexican residents. So that's a little bit about what I do. I've been in the HIV field pretty much my entire life, so 20 some odd years now of being an educator and then being a case manager and program manager and writing grants and all that fun stuff. So it's landed me where I am now. So that's a little bit about me. And I use he, him as my pronouns, and Ryan is more than fine. So.
You're on mute, Dominic.
Thank you, Libby. I appreciate it. There's my forgetting to unmute faux pas for the day. I know we're all allowed at least 2 of them, right? I try to minimize mine to just 1. But thank you very much, Ryan. We appreciate that and the introduction. And next on the list I have is Dr. Matteo Pearson.
Sorry, took me a minute to get to the controls. For the Googler, I'm Matthew Pearson. I am a research associate professor at UNM. I work at the Center on Alcohol, Substance Use, and Addictions. I'm predominantly a substance use addictions researcher. I'm trained as an experimental psychologist. I started my research in alcohol and founded a research organization called the Research Society on Marijuana to sort of fill a gap of applied research on cannabis and its effects, ranging from medical to more salutary effects and as well as deleterious effects. I think that's sort of why I'm here. I go by Matteo.
Thank you, Matteo. We appreciate it. And so next I have Dr. Eileen Barrett.
Hi, good afternoon. I'm Eileen Barrett, and my pronouns are she, her, hers. And I prefer to go by Eileen. I am also boarded in internal medicine, and I have a master's in public health. And I'm practicing as a hospitalist, which means that I practice solely within the hospital. Although I also, my areas of research and publications have generally been in health disparities, racial justice, gender justice, and also in the care of improving the care of people with substance use disorders, particularly within New Mexico. And am pleased and happy to be here. Thank you, everybody. And I'll also note that my husband and I are both, he's I think on Zoom right now while I'm on WebEx. And so we often don't have enough bandwidth for that on our Wi-Fi to continue. So my camera will be on and off, but I'm still here.
Perfect. Thank you, Eileen. And we completely understand about that with the camera. We should probably note, just in case anybody did come in after I had said it, we are recording. And while it is great to see people's faces, we do understand sometimes the bandwidth on the connections can be a little tricky. So we understand if you have to go to a dark screen. So thank you very much. And then let's see, next that I have on my list is Martin Walker.
Hello, everyone. Thanks for introducing me. So I'm Martin Walker. I am down in Las Cruces, New Mexico. I am a longtime advocate for medical cannabis and recreational cannabis. I am a medical cannabis patient. I've been working in the fields of HIV prevention and harm reduction for about the last 20 years, working primarily with queer folks and people who are experiencing substance use. And so I'm really excited to be here. And thank you.
And Martin, well, although I've now revealed it, how do you prefer to be addressed?
Martin, and my pronouns are either he, him, or they, them. Thank you.
Thank you, Martin. And that brings us to Matt Clark.
Good afternoon, Matt Clark. I'm the Emergency Services Director down at Otero County in Alamogordo. Military brought me to New Mexico many years ago, and I kept gravitating back to New Mexico. While I was here, I did get my EMT basic license, and I've been practicing on and off emergency medicines since 1989. Kind of excited to see where this committee is going to take us, and look forward to working with everyone. And I go by Matt.
Thank you, Matt. And Libby, we have a hand up among the attendees from Toby Rosenblatt. Can we unmute Toby for him to be able to speak?
Yes, one moment.
Okay, great. We'll have you on in just a moment, Toby.
All right, I requested for him to unmute himself. There you go, Toby.
I'm Toby Rosenblatt. I'm with the Injury and Behavioral Epidemiology Bureau in the Epidemiology and Response Division of the Department of Health. We work on several things. One, injury generally. Another is substance use epidemiology. And the third is overdose prevention. And I go by Toby. Thank you.
Thank you, Toby. And we do have a couple other folks that are on the attendee list. Joshua, would you like to introduce yourself? And Libby, can we do the same there? And then after that, let's go to Mike from CPPC. And we'll let him say what CPPC is.
Okay, Joshua.
Hepatitis and Harm Reduction Program Manager with the New Mexico Department of Health. We oversee syringe services, viral hepatitis, and overdose prevention and naloxone distribution here at DOH. So it's great to be with you all here today. And a lot of our community members are utilize cannabis for a variety of reasons. So that's why I have an interest in this committee. So thank you all for joining.
Thank you, Josh. And then Mike, would you introduce yourself?
All right, I requested his. There you go, Mike.
I got my PhD in behavioral psychology 4 years ago. Did a postdoc at Dartmouth College on cannabis, and last year or two now I've been working for cannabis policy consulting. We work with New Mexico right now on really taking a lot of different research studies at population levels related to cannabis, and working in conjunction in partnership with New Mexico DOH to try to help translate that to policy and other insights moving forward. Thanks.
Okay, and thank you, Mike. And I know the sound was a little glitchy on my end. Just for those who didn't hear it, Mike is with the Cannabis Public Policy Consultants, and they are a contractor with the Department of Health and Medical Cannabis Program to help do some of the research that about cannabis that we're going to be moving forward from a demographic standpoint. with patients and with providers as well. So that's information we'll talk a little bit more about. The other members who are actually on the attendee list are some of the staff members from Medical Cannabis Program. So if any of you want to introduce yourself, go ahead and put your hand up. Otherwise, we will move forward to the next step. Okay, and I don't see any hands, so that's perfectly fine. They mostly are here to see what exactly is going on today. So the next step is I just want to do a brief little presentation to give you all an idea of where the medical cannabis program is right now. And then with the agenda that we had sent out, the next step will be election of the chair, and then adoption of rules of procedure, and then a little bit of discussion about the committee's purpose, and then other items that you all may have, and then scheduling the next meeting or regular meeting times and dates so that we can move forward. This really is an introductory meeting, and I'll go ahead and facilitate it if there are no objections to me doing so. That way also whoever is elected chair can then sort of see how the meeting can progress and kind of move forward from there. And any questions so far? Okay, so let me just share my screen here. Okay. Can everybody see the PowerPoint presentation? Okay, I see lots of heads nodding. Of course, this is just an update for the medical cannabis program. Before we start, we want to make sure that we always acknowledge the fact that we are on unceded ancestral lands for the original peoples here in the Southwest. That includes Apache, Navajo, and Pueblo. And so with gratitude, we do pay our respects to the land, the people, and the communities that have and continue to contribute to the state of New Mexico. And the mission here at the Department of Health is to help ensure health equity. We work with our partners to promote health and well-being while improving health outcomes for all people of New Mexico. We have several goals, which include expanding equitable access, improving health status, ensure safety, and all of this while trying to support each other. And that's not just the other community organizations and agencies, boards and commissions, but also each other within the department, the staff and contractors and anybody that we work with and are connected with, by promoting an environment of mutual respect, trust, open communication, and helping to provide needed resources for staff and others to serve New Mexicans to grow and reach their professional and other goals. So a little bit to cannabis itself. The Lynn and Aaron Compassionate Use Act is the major statute that we follow for the Department of Health Medical Cannabis Program. And the purpose of that act is to allow for the beneficial and medical use of cannabis in a regulated system to help alleviate symptoms caused by debilitating medical conditions. In 2021, as I mentioned earlier, the Cannabis Regulation Act was passed and actually has split what used to be a program that did both licensing and registering patients into two separate programs. One, the medical program, which remains with the Department of Health, and then the licensing program, which moved over to the Regulation and Licensing Department. And so with that, this slide just is showing a little bit about some of the state agencies that are working on cannabis issues. Now, there are actually others that are involved in various areas. For example, the Division of Higher Education or the Department of Higher Education is involved with regard to some educational programs and training that they are helping to get moving forward. For example, New Mexico Northern Community College has a program. The continuing education at the University of New Mexico has a program that helps to train servers or bud tenders and other people involved in the cannabis industry. And so this is just a little bit of the agencies cannabis is affecting and influenced with so many different aspects of the New Mexico state government, as well as within the various communities in New Mexico. So this particular committee was created through the CRA, or the Cannabis Regulation Act, in 2021. And what I have here on the slide really just shows the main purpose behind the act. And I know it's very wordy. Most of you who know me and how I do presentations, I don't like a lot of text, but in this particular case, this is directly out of the statute. And so if you want to read it on your own, it is also statute 26-2C4, which again is part of the Cannabis Regulation Act. And what it really is saying is that there needs to be a report starting at the end of 2024, December 1st of 2024, that includes the various elements such as child access, road safety and DWIs, workplace safety, emergency room visits, educational needs, consumer product safety, percentage of poison control center, calls that are related to cannabis, and then of course the impact of cannabis on the rates of alcohol, opioid, and other substance use. And again, this is beginning in December 2024. So a little bit about the medical cannabis program itself, as far as where we are at the moment and what kind of support we also can help to provide, is prior to the passage of the Cannabis Regulation Act, when we had both licensing and the patient registry, the program had 28 full-time equivalent positions. Once the Cannabis Regulation Act went into effect, we actually transferred 13 positions over to the Regulation and Licensing Department for them to start up the Cannabis Control Division. Cannabis Control Division is primarily focused on the regulation and licensing of the various cannabis establishments, from cultivation to laboratories, manufacturers, sales or dispensaries, and transportation as well. Medical cannabis program continues to work with the patient side, so patients and providers, and the cannabis patient registry. And so when the 13 positions were transferred over, the Department of Health, we were able to create 3 new positions for the medical cannabis program. So we actually have 18 full-time equivalent staff members currently in the program. And the reason this is important is because you can see we have patients enrolled in every county throughout the state. And Ryan, I see you're trying to look a little bit. Chavez County has just under 4,000 individuals enrolled. But I did want to let you know, we pulled this at the end of last quarter, so September 30th. Currently, we actually have close to 128,000 patients, and it'll probably be over that by the end of the calendar year. In the last quarter, so that's July 1st to September 30th, we had received just under 15,000 applications and renewals in the program, and we're able to process those. To give you an idea of what we have also accomplished, our processing time has gone from just over a year ago in September of 2020, we were processing applications in just over 28 days. And we actually have a statutory requirement to process applications within 30 days. We currently are actually in December this year, right now, what we've processed so far for December, we are actually at 7 days. So, and I know, so Alan from the Medical Advisory Board, I know I mentioned the other day during that meeting that we were at 14 days as of at that time. That was back in November. We now are down to 7 days because we continue to process the applications. We've streamlined a lot of processes and really been able to get it so that it's a lot more friendly for the patients and a lot easier for them. And a lot of people would say, well, it's probably because your enrollment numbers are going down, and that actually is not the case. So what this slide is representing is how many patients are enrolled in the program. And you can see back in September of 2019, we had just over 72,000 patients. We increased by 26,000 patients from September 2019 to September 2020, and another 26,000 patients from September 2020 to September 2021. So what has actually happened is we've increased by 52,000 patients in the last 2 years, but it's actually been very steady with 26,000 each year. And that steady application process has been continuing into this year as well. As I mentioned, we're already, from when these numbers have been pulled, have an additional 3,000 patients already added to the enrollment process. And the most three commonly utilized conditions or qualifying conditions for enrollment in the program are post-traumatic stress disorder, which again at the end of September had just under 68,000 patients or individuals who had that listed as their primary diagnosis for their qualifying condition, which by the way is half of all the patients that are enrolled in the program. The next condition was severe chronic pain with 37,685 individuals. And then the third most common condition out of the 28 qualifying conditions that we have was cancer, with just over 6,000 individuals recording that. Now, this does not necessarily mean that an individual who is enrolling in the program for post-traumatic stress disorder doesn't also have some of the other conditions. So this is just their primary condition. So an individual could have multiple conditions, but we only, as for the program, are only recording their primary condition on why they're enrolling. So for example, somebody who has severe chronic pain, the severe chronic pain could be being caused by another condition, or another qualifying condition, but that is the particular reason that their medical provider enrolled them in the program.
Dominic, just to stop you there, Eileen did have a question in the chat if you wanted to touch on that.
Gotcha. I apologize with having the PowerPoint up. I can't actually see the questions. So Eileen, yeah, do you mind reading it?
Oh, sure. This is Eileen, and just forgive me. Was that for me or was that to read?
Go ahead.
Go
ahead, Eileen.
Oh, thank you. I know that this is a little bit different because that really is going to be falling under the other group, but I was really recently surprised to learn that there's more recent evidence and more recent recommendations against the use of cannabis in PTSD due to that it can worsen the symptoms for people. And I think that that's been surprising for a lot of states to learn that. And I'm wondering if the qualifying conditions are being the time frequency with which they're being reviewed for the as emerging evidence on the on the benefits and also some of the drawbacks of using cannabis in treatment becomes available.
Right, and Eileen, that is a great question. So as some people who are on the call know, and others may not, so I'll just kind of describe a little bit, is anytime conditions are added or removed, that's actually a process that goes through the Medical Cannabis Advisory Board, the Medical Advisory Board. That is definitely something that actually can be petitioned to the advisory board. So what has to happen in that situation is an individual has to petition for the addition or potential removal of that. The advisory board then reviews through there, provides a recommendation to the Secretary of Health, and then the Secretary of Health makes a final decision. Now, there are a few, some conditions, and I'd have to go back to look at the statute itself. When they did some of the updates to the statute, and this is the Linen, Air, and Compassionate Use Act, they added several conditions as statutory conditions. And so if that's the case, and if PTSD is one of those, then it would also have to then go to the legislature to actually change it at that point. And I don't actually have that up right now. And from a practical standpoint, it usually doesn't make a difference. Chris, do you happen to have that open? And if not, could you go ahead and do that while I finish up the presentation?
Yeah, I can pull that up. I'm pretty sure that PTSD was added to the statutory list. And so it may be something that would actually require a statutory amendment. But I'll double check that while you're doing your presentation and follow up shortly.
Great. Thank you, Chris. And that's a great question, Eileen. A great question. And by the way, I should say, while that, as far as recommendations on conditions resides with the Medical Advisory Board, this committee can also be pulling some of that information to be able to turn around and say, here is some of the more recent evidence and peer-reviewed articles and studies that are actually showing what's happening. And quite frankly, is something this committee can decide to do. And members of this committee could decide to move that forward as a petition. Does that help?
This is Eileen. I think that was really helpful. That was very helpful. Thank you so much.
Haley?
Dominic, I'm just wondering if the department has any sense of how the numbers for the medical program might change once the recreational program is fully in effect.
That's a great question, and I don't have a slide on it, but let me do the next slide. And then I think that's a part of the discussion of the committee's purpose. So if you're okay with holding on to that,
Sure.
Because I think that's actually a broader question about kind of how things move forward. And it's a great question. And I saw a couple other people nodding their heads when you asked it. So I want to be able to give it the time that it deserves. And I think that that'll be a really great thing, but we do have to go through a few housekeeping items first,
Sure.
if that's okay. Okay. And then the last slide that I actually have is just a quick screenshot. We were able to institute during the time of COVID an online patient portal so that patients can actually register online, especially with the updates to the Linen Air and Compassionate Use Act and the CRA in 2021. It allows for telemedicine, whereas previous to that, the telemedicine requirement still required an initial visit or an in-person visit with a patient. The new definition for telemedicine does not require that for a patient to enroll in the program. So a patient can see their provider through telemedicine without ever going into their office and do all of the paperwork online. So that makes it a lot easier and a lot better. And this, of course, we found to be very important during COVID-19. And we have more and more providers who are actually registering to do this. Gary, I did not ask you in advance, so if you don't have an exact number, that's okay. But could you tell us about how many providers do we have registered for the online system now?
I would say 55. Yeah.
Okay, so about 55 providers. And I know last time I looked, we had about 2,500 applications coming through that process. Do you have an idea of how many we have now?
It continues to increase. I couldn't say it's more than that. How about that? But maybe 2,600. But yeah, we continue to have a really good response. A lot of the providers are calling me on a daily basis and getting more and more excited to use this. And so I do think that we're seeing this ebb toward the electronic portal. But I don't have the exact number, sorry.
Not a problem. And just so everybody knows, I put Gary on the spot there. I forgot to ask him about that. He didn't know I was going to mention the portal during this meeting. But I think it's an important tool because it really is helping individuals. It also helps greatly for access in some of our more rural and frontier areas of the state. So people who don't necessarily have the ability to drive for far distances. Of course, some of those issues there are still areas of our state that are rural and frontier that don't have very good internet access. And so unfortunately, it's not necessarily helpful in those areas, but we hope that that continues to improve. And so from a program standpoint, we continue to try to move things forward to make that access for patients and providers as easy as possible. One of the other things that is available through the registration in the online portal is once patients register, they also can see what their unit report or their usage report is. So they can see how much they've purchased from all the various dispensaries and be able to, look and see how much do they have with regard to what's called adequate supply, which is how much an individual patient can actually purchase through the program in a 90-day period. And that currently sets at approximately 8 ounces, and patients can actually get an exception to go up to 12 ounces. However, we do have in process right now a regulation change, and that was just approved last week by the Medical Advisory Board, which is to move that up to 15 ounces. And in a unit standpoint, because we use units, that actually means 425 units. Sometimes people ask what a unit is, and just it's hard to be able to measure cannabis if you just turn around and say, here's an ounce of cannabis. If you're talking about flower or bud, that's an easy thing to measure in weight. But if you're then talking about something in a concentrate, such as an edible or a salve or an oil, that's very difficult. What do you actually weigh in that case? Do you take a brownie and weigh the brownie and say, oh, you've just used 2.5 ounces of your supply? And so for those types of products, if it's not flower and bud, it's based on the content of THC. And so it's 200 milligrams of THC equals a unit. And that way, so that's why we utilize units. Because could you imagine in some states, for example, cannabis drinks are becoming very popular. So could you imagine suddenly we turn around to a patient and say, here's 1 8-ounce, cannabis drink or drink with cannabis in it. And that just 2 of those would take care of even the new proposed higher limit. And then you're done. And so we wanted to ensure to do this in as fair and equitable a way. And this was a decision that was made many years ago. And we keep looking for other potential improvements, but so far nobody has come up with a better way to track those sort of items. Does that help? And any questions so far? Okay, well, our next item on the agenda is actually the election of a chair for this committee. And as I had mentioned, I think prior to the meeting actually starting, since this is the inaugural meeting of the committee, I was just helping to sort of move things forward. I am not actually a member of the committee, being that I'm actually the director of the program. The statute actually, it was set out in such a way that I'm not a member of the committee. And so I'm helping to facilitate for today, but we do need to have one of the committee members to be chair. And so what I would recommend is at this point in time, if there's anybody who's interested, so self-nominations are allowed to be chair, and then also for a vice chair in the event the chair is not able to make a meeting. Or other people can nominate individuals as well. So is there anybody who would be willing or interested in being the chair for this committee? And for those of you who don't know me very well, I'm very comfortable with silence. Eileen has said that she is interested in being vice chair.
Maybe you can tell us, Dominic, the sort of the criteria for qualification for chair should be in this particular case.
So that's a great question, Hallie, and it really is actually up to this committee to make that determination. But primarily because this is not a committee that is making regulation changes or regulatory changes. So reality is the chair is really just to moderate this particular committee and assure that votes that are taking are following the correct procedure. but there really are not a lot of duties or responsibilities. The program itself will help as far as sending out. We'll also say we will also send out the meetings, setting up the meetings, and so that is not something the chair has to do. That would just really be to moderate these meetings and ensure that that things move smoothly through them. Oh, and I do see that Martin has put in the chat that he believes he has the capacity to step in. Is there anybody else?
Dominic, I know that I discussed that I might be leaving the state at some point, so I didn't know. I don't want to nominate myself, but I'm willing to help in the interim if need be, and so I just want to put that out there. I don't know where that stands. So.
Gotcha. And we understand that completely, Ryan. And I think that's really good. I think since Martin has offered to be the chair, that sounds like that's most reasonable. And then maybe once the determination is made, Ryan, as far as your status, we maybe could revisit it at that point, if that's something. I see Martin nodding his head yes. And then Eileen said she would be willing to serve as vice chair. And again, that's just if the chair can't make the meeting, to really help move the meeting forward. So what I would like to propose to all of you is that perhaps Martin serve as chair and Eileen as vice chair. And is there anybody who has any issues with that, or shall we record that as our as the response with our new chair and vice chair?
I don't know if do you need Dominic, someone to make a motion as a committee member? Would I need to or I would make a motion then that we move forward with Martin being the committee chair and Eileen as the vice chair.
I would second that.
Okay, I'm not sure that we actually need the motion, but I think that it's a little bit better from a legal standpoint to have it than not to. So thank you very much. And since I'm just facilitating this, let's just move forward with a vote, since we have a motion and a second for Martin as chair and Eileen as vice chair. And for all those saying aye, if you can either give me a thumbs up or put it in the chat if you don't have visuals.
Aye.
Aye.
Or aye. There we go. And I see all the committee members are in approval, so it is unanimous. So thank you very much, everybody, and thank you, Martin, and thank you, Eileen. We appreciate it very much. If you are okay with me continuing to facilitate for today, and if we do have any votes, I'll turn it over to you, Martin. I know your experience in chairing meetings, so I know you already know how to handle that aspect. But if you are okay with me continuing for today, okay, and I see a yes and doing that. So the next step was the adoption of rules and procedures. And so with this, these are just essentially the bylaws and the procedures that the committee will follow with regard to membership and quorum and voting eligibility. I believe those were sent out to all of you in advance. Had everybody received those? Okay, I'm seeing lots of yeses. I guess I should ask, is there anybody who did not? Okay. Is there any questions or any discussions about them, or do those procedures seem like they are reasonable? Seeing again, lots of head nods. Just to go through them really quickly, it really just talks about the statute providing for the membership and the reasons for the membership. And then the voting eligibility is just an individual who's been appointed by the Secretary of Health, and that if someone has not attended 3 consecutive meetings, may be asked to resign. A quorum shall consist of a majority of the members who have been appointed and have attended the last 6 consecutive meetings, or 3 of the last 6 consecutive meetings. And that for quorum, it is determined that a majority is 50% of the voting members in attendance. That we do follow the Open Meetings Act, the meetings will be announced on the Department of Health Medical Cannabis Program website and shall meet at least quarterly, with the meeting announced at least 7 days in advance. And by the way, that is the one question that I have for this group is that often enough? Or would you like to meet more often? What would you like to include in here? Just for my 2 cents, I would recommend leaving it at quarterly. Nothing says you can't meet more often, because it is at least quarterly. And then they'll be held at a designated location as announced, selection of the chair and vice chair, and then just that they can really be changed. The bylaws can be changed by 2/3 of a quorum.
So could you just explain, is there a difference between procedures and bylaws, or is it consolidated into one document and don't need to be separated out in some way? And how much of this is statutorily required or state procedurally required, et cetera?
Great question. So they are just folded together so that it really just becomes part of the procedure. I'll let Chris, you look like you were going to say something.
Well, I think on the question of, are these statutorily required? Not really. I think, for example, I don't know that the statute necessarily speaks to how often this committee has to meet, which is interesting. Usually statutes cover those sorts of things. As far as like the quorum and so forth, that would be sort of consistent with standard statutory interpretations. But yeah, generally speaking, these are a little bit more detailed than what is outlined in the statute, but still useful.
Okay.
And can anybody call a meeting, or does it have to come through? So let's say you ask the question, should it be quarterly? But let's say there's new information that arises scientifically, epidemiologically, whatever it might be. I see to request a meeting to discuss either that or other things that might come up.
Yes, and that's why it actually says at least. So so that if there are other things that come up, then an additional meeting or additional meetings could then be called. So say, for example, when we get to that time where the initial report is due in 2024, the group here, the committee, may decide to meet more often to ensure that everything is in line and is correct, and presented in a format and fashion that they prefer.
Right. Well, could somebody from the committee then request a meeting, or how would one initiate a meeting if it was going to be more often? And I guess that's also related to another question I have is it possible for each of us to write up a short bio and contact information? So we have the emails, but we don't have phone numbers or however else we might be in touch, so that we could have more. For example, I didn't mention I'm from Santa Fe. Some of you mentioned where you're living, and some didn't, so it could be useful.
Absolutely, and we can do that. I would say that's a great thing for us to do, outside of course, the rules and procedures. But again, it's up to you. If you all would like to add a provision to this that simply states, any member can request the chair, I would say that would go to the chair, that we hold a new meeting. That perfectly fine, but that is up to all of you. And again, that's if you feel that's necessary at this point.
We can always change them as well. I don't think we're really going to know what all we're going to be doing until we get into this a little bit, but we should be able to, as a group, change our bylaws anyway, correct, moving forward. So, not without knowing what all this is going to entail. I think we're all going into this a little blind. I think that I would be okay with the way they're written now, knowing that we have the ability to change them moving forward.
And Ryan, thank you. That is one of it, that they can be changed by a vote of 2/3 of the quorum in here. And again, if you want to change that, that is all up to you. Okay, so at this point, this is a procedural portion. So Martin, I'm going to turn it on over to you as far as motions or.
I'm sorry, can I give one more question suggestion?
Please do.
Getting basically kicking out committee members. It sounds like that can happen if people are not attending the meetings. So there's the language in here about missing 3 meetings, consecutive meetings, that you can be asked to resign. In other organizations, we've done it as 2/3 of the members to basically vote someone off. I would put forward that maybe move that up to 2/3. Otherwise, it's really sort of easy when you're connected to just a few other members to kick people off.
And I'll go ahead and answer that. So Mateo, that would be fine to add something in there as a secondary way. But all the membership on this is at the discretion of the Secretary of Health. And that's why what it says is if they miss 3, it'll be submitted to the secretary and you may be asked to resign at that point for non-participation. That's that aspect. But if you wanted to add a provision for the committee itself, that would be perfectly fine. And again, I'll turn it over to Martin at this point so that if there are motions to do these changes, they can be done and I'll record.
Thank you, Dominic. So it sounds like some folks have suggested a couple of things. I saw in the chat that Eileen had said something about recommending against changing quorum size. So is there a motion?
I would just make a motion that we accept the bylaws/policies as presented.
Thank you, Ryan.
Yeah.
Do I hear a second?
This is
I see.
Eileen. I'll second. Oh.
Thank you, Eileen. Okay, so it's been moved and seconded. Can I have a voice vote, or you can do the thumbs up emoji or the thumbs down emoji as necessary in the thing, or just put your literal thumb up, and I'm sure somebody is recording that. All right. Is there anyone opposed? Any discussion? Okay, sounds like we have adopted these policies and bylaws document as our own. I'll turn it back over to you, Dominic.
Thank you, Martin. And we have had another committee member has been able to join, and I would just, and it is Dr. Katie Witkowitz. And Katie, I hope I'm still pronouncing it correctly, or at least close enough. We did have everybody go through and just introduce themselves briefly and how they prefer to be called, at least for sake of this committee. So if you don't mind introducing yourself.
Sure, yeah, and sorry to be late, and I also have to leave for another meeting at 2. Unfortunately, today is a little bit packed. So I'm Katie Witkowitz. I'm a professor at UNM in the Department of Psychology and also at the Center on Alcohol, Substance Use, and Addictions. I've been studying substance use disorders for 20 years, and I'm also a licensed clinical psychologist and have provided treatment. And I'm very committed to harm reduction-based approaches to everything. I think we should all try to reduce harm where we can. And I'm really excited to be a part of this group. And my research has mostly not focused on cannabis, and my clinical work hasn't definitely focused on cannabis, but I've always followed cannabis research. I'm also the editor of Psychology of Addictive Behaviors, which is one of a journal in the addiction field. And I prefer to be called Katie, is great. So nice to meet you all and great to be here. Thanks, Dominic.
Great. Thank you, Katie. And then Haley had brought up the idea of everybody sending in just a brief little bio. So I would like to propose, if people don't mind doing that, why don't we say because I know the holiday's coming up, why don't we say by the end of the calendar year? That way it gives people a little bit of time. I know a lot of folks already have a little bio prepared for things that they do. Just to let everybody know, this is something we will put up on our website. We will, of course, redact phone numbers and emails from them, but we will put that up along with the roster. That way people have an idea of who you are on that aspect. But yeah, we won't be giving out your personal phone number. So.
And Dominic, where would you like that sent to?
Let's see. Why don't you go ahead And if you can send them to Gary for now. And the main reason I say that is I will actually be out of the office next week, but I believe you all have Gary's email. So if you can send it to Gary, and for us internally, we'll get that aspect taken care of once we have them. Okay, great. And that was a great suggestion. So thank you very much, Hallie. So the next item on the agenda is just a discussion about the committee purpose. And so Hallie, you had actually kind of started a little bit with this on your question earlier. So statutorily, the purpose of the committee is really to help make sure that the information for that report starting in December of 2024 is as accurate as we can, and that we're getting it disseminated. Technically, it's actually the responsibility of the department to disseminate the information, but of this committee to try to help to do that. And with that in mind, we actually, from a department standpoint, will be, of course, utilizing a lot of the various databases that are available through us and through the department, and especially with our epidemiology and response division. So we'll be working through, many of those databases to help provide information. We also, as I mentioned earlier, we have contracted with the cannabis public policy consultants in order to do some additional surveying of patients and some providers to help give us a start on some of the additional research that needs to be done. And of course, many of you are involved in various aspects of research and areas of study with regard to cannabis, and we're hoping that that will also help to add to the report itself. And so at this point, that's really what's required from a statutory standpoint. The rest of it is really up to all of you. And so what are your thoughts with regard to this?
So there'll be surveys and there'll be additional research being done in state, correct? And you mentioned surveys.
That's correct.
Okay.
And so,
any suggestions on connections, or, for example, I'm sure you have connection with public safety, with other organizations in the state. But what would you like suggestions on research approaches, or, and obviously this won't happen right away because we need to see what's going on and how it's going on. But what is it you want from us further than just reviewing reports, for example, that will go to legislature?
That actually is up to all of you. And it really comes down to how involved the committee wants to be in that aspect of research and fact finding, and really trying to figure out what education really needs to be provided with regard to evidence-based or experiences. And I don't mean this as trying to call anybody out, but like, for example, Matt and I have talked in the past under other circumstances about how cannabis potentially can have an effect on first responders, for example. And really, so how can that kind of information be gathered in the best way possible?
Hey, Dominic, I was thinking maybe we could share the list of items that are mentioned in the statute that are intended to be covered in the committee's report. I don't know if I can, maybe I can share my screen here.
I can do it, Chris. I have it on the slide.
Do you have it up?
I have it on the slide, so people should be able to see it now.
Oh, perfect.
And so really the report, again, what it really looks at is the following elements related to cannabis product use, and as applicable, the demographics of persons who are subject of an element. And again, that's the statutory language. And so we've got child access, road safety and driving while impaired. And Haley, you mentioned about public safety. We will be having individuals from DPS, the Department of Public Safety, involved. They just were not able to make today's meeting on that for this. Workplace safety, percentage of emergency room visits and outcomes, educational needs for children and adults, consumer product safety, percentage of poison control center calls, and the impact of cannabis use on rates of alcohol, opioid, and other substance use. So essentially, how cannabis affects everybody in every way possible. That's really what it kind of comes down to. I did see a couple of things popped up in the chat. And again, I apologize. They flash on my screen only for a minute when I share. But Martin, I saw one came from you and one from Eileen. And Eileen, I see your hand is up. So Eileen, why don't you go ahead?
Yeah, thank you. What I was just saying for those who may not be able to look at the chat is that I would recommend and I would like to request also if we work to develop a shared mental model for the existing literature, specifically as it relates to everything that you're showing in our charge, because there are areas where there is literature, and there are areas where there are best practices, and where there's area where there's both, and there's areas where there are neither. And I think that us being on the same page about that, I think will help us do the best work together, and help us best fulfill our fiduciary duty in the spirit of the public's health.
That sounds great. And really, for that to happen, I think that one of the better ways is, rather than try to do it all as a larger group all at once and start from scratch on that, is there anybody who's willing to work on that, developing that kind of framework and model, and maybe bring to the next meeting for consideration? Eileen, I'm not sure if you have your hand up for yes for that, or if it's just remaining from.
I lowered it and then I put it back up because I would love to work with other people on that.
Okay, so are there other people who would like to work with Eileen on that?
Can you define what you mean by a mental model?
Oh yeah, thanks. I was thinking of just when I say a mental model, that's a term that I often see used for when we just want to make sure that we're all operating from the same knowledge base, and have the shared understanding for where there is scientific literature, where there is evidence versus where there is consensus, where there is neither, and where there are best practices and policies that might be present, or lessons learned, advantages and disadvantages from other states, from their experiences. So that we're not coming to this work with, well, I have one opinion and someone else has another opinion and someone else has another opinion and someone else has another. Instead, that we can have our opinions, of course, as we should, but that our opinions can have a foundation of what is known to be solid public policy recommendations, and also solid evidence. Like, say, for example, one of the things that has come up, say, for example, about this is differences about medical. Oh, actually, I could talk about recommendations from the AAP, which is the National Professional Society for Pediatricians, and that they have some recommendations about labeling. There's an excellent article in the New England Journal of Medicine about some complications related to labeling of products and how they affect child access and how they have affected poison control. And so just thinking that might just be helpful for us to be operating from the same knowledge base.
Yeah, thanks. That's helpful, because one of the things I noted is missing in our 1 through 8 on here is there's been some discussion in the literature that excessive marijuana use can lead to mental health issues. Maybe the alcohol, opioid, and other substance abuse is part of that, but it can also be just simply, not so simply, but mental health issues aside from substance abuse. So might be something I want to consider as well. But yes, it would be great to have sort of a central depository of information where we could go to if we wanted to find, what does the literature say on X, Y, or Z. There was, by the way, a very good NOVA program on this. If you can think that in an hour anybody can really fully understand all of the information about it, but they sort of, as a broad brush, talked about a lot of the gaps in knowledge in cannabis and endocannabinoids and cannabinoid use. So I recommend it to those who can get to, I think that's National Geographic Channel. Oh,
Hey, this is
PBS.
Eileen. I had missed that one. Thank you for pointing me to it. For anybody who, I just added it to the chat if that's helpful to you.
Yeah, Dominic, I guess, Dominic, do you know, are there other states that have done a similar kind of committee and report? I know hearing some of my locals, I know I just saw that about Colorado. I know our local Eileen had shared that Colorado has done that, and I know that our local leadership here, we serve people across all Southern, but I actually reside in Roswell. We have another office in Las Cruces, but I know that our city council has taken that report from Colorado and cherry picked lots of different stuff out of it to then make things very difficult for people in this area. So I wondered if there's like best practices and like, has Colorado learned lessons of, oh, we really should have been more careful with this report, so people that might not be supportive of this or people who had different opinions than I just didn't know if there were other states out there and good models of what impact this committee could have.
Right, and that's a great,
right?
Yeah, and that's a great question, Ryan. And some of the things that we will be starting to do with beginning of the new year is start to disseminate to all the committee members some of those reports that we are gathering and working on gathering from various states, and so that you all have that information and don't have to really recreate from scratch, but be able to look at it and also see some of those lessons learned. Because I think that you have brought up a very good point about how some of these reports that have come out from other places have actually been cherry picked. And sometimes that can create problems for local jurisdictions or for patients within local jurisdictions. So that's a great point.
Right.
And we do plan on doing that.
What's that?
One of the things we are also doing on our website is starting to create a resource page where things like such as articles, evidence-based studies can actually be linked and or placed so that there's sort of a repository for that. And not just for this committee, but in general.
A few years ago at the APHA, Colorado was presenting their first year of results, and the state of Washington was just putting together their committees and study areas. So they may be another state to look to as well.
I also, that last bullet point of what the committee is going to do, I'm very interested with the amount of harm reduction program stuff that we do, looking at harm reduction and how cannabis might help some of our individuals who are using our other programs. So, there's a lot of studies coming out about using cannabis as a substitute or as a harm reduction, part of a harm reduction model. So I would definitely be interested in some of that as well.
Yeah, and just to let you know, Ryan, we are also, as we're looking at some of the studies, we are incorporating a lot of harm reduction into that.
And I think Haley had mentioned, Haley, I'm sorry, how do I?
I take any of it, but Hallie is the way I pronounce it.
Okay, sorry. Hallie had mentioned earlier about the number of people who might move off the medical or how this would impact that medical. I would like to circle back to that. And I think, is there some kind of rule about how much percentage still needs to be medical versus recreational, and how will that play out? Or can you give us any feedback on that?
Absolutely. And thank you for bringing that back on up. I was waiting for this part of the conversation about resources to conclude. So we don't really know fully on how recreation will impact the medical program. the information that we have been getting indicates that what may occur is that our enrollment in the program may dip somewhat when recreational sales start, but that it'll very quickly resume and or go past really what we have currently. And by that, I mean really just the rate of people applying. Now, part of that is because there is the tax break for individuals who are medical patients, where basically medical patients, for the adequate supply portion of what they purchase, are not subject to tax in New Mexico, versus the recreational sales are subject to tax. And so what we really anticipate seeing is we anticipate seeing individuals who do intend to use it for medical purposes to continue to do so. And in the states that have done things similar, what they have seen is they see a slight dip at the time of recreational sales starting, and then their program continues to move forward. Their medical program continues to move forward strongly. And so at this point, that's what we're anticipating. And but of course, one never really knows until it actually happens and occurs. But since the tax rate is at 20% to start, I would think that a lot of people are going to say the upfront cost of seeing their medical provider is going to very quickly be, it's sort of like going to a membership club. You have to turn around and pay your upfront membership fee, in this case, paying for your doctor to do your certification, but then you get the benefits of lower prices throughout the enrollment period. And so we think that people who are using cannabis on a regular basis for medical conditions will continue to enroll in the program because they will get a lower price effectively because of not having to pay for the tax. And so we'll be continuing. From a program standpoint, that also means that one of the things that we have to watch for is to do our due diligence to ensure that people who are enrolling are doing so through the legal process, having a provider who's signing for it. We have had situations where individuals have gone online and gone to providers who are in other states and not actually within New Mexico trying to certify. We do check for those sort of things. Gary actually just did that last week, actually with a particular provider the last 2 weeks. And so we do continue to do that kind of verification. And that's really what the medical program will continue to do. As to differences in strains or strengths, the statute actually does not outline any differences between it. Really, the only difference between adult use cannabis and medical use cannabis in New Mexico will actually be the individual purchasing. So are they enrolled as a medical provider or are they not? Now, some other states have done things where they have THC content, and so that's something that is that happens on a regular basis in some other states, but that is not how the statute here was written. It really is about the status of the individual purchasing. So that's really the only difference between them. Now, what individual dispensaries or manufacturers do, that will be up to them, so long as they're falling within the statute. So that's going to be some very interesting questions, and that is some of what we plan on surveying patients with regard to concentration and types of delivery methods. So is it lotion? Is it, edibles? Is it smoking, vaping, and all those sort of things? And hopefully we'll see more information about that over the next year. I hope that answers your question. A lot of it is we don't have a lot of answers yet, and that's a part of it. What do we need to look at to get some of these answers?
Hey, Dominic, the only thing that I was going to add to what you were just saying, apart from tax benefits, the Lynn and Aaron Compassionate Use Act also provides for some employment protections for people in the medical program. Those don't extend to persons in safety-sensitive positions, and I think there may be another exception in there related to positions that are funded with federal dollars or something like that. But there are some employment protections that may also steer people towards the medical cannabis program. And then also another issue is the fact that commercial cannabis or recreational cannabis is only applicable. It's only lawful for persons 21 years of age and older, and so whereas someone of basically any age can be in the medical cannabis program. So minors as well as individuals who are over the age of 18 but not yet 21, they could only access cannabis through the medical cannabis program, and that may also steer people towards the medical cannabis program.
And the last part, I don't know if you heard that, but our city council was talking a little bit about that the medical dispensaries had to do a certain percentage of medical versus recreational, and how does that impact?
Right. So that's a great. It's just they have to have a certain percentage of their sales to be medical in the event that there are shortages, and that's really what that comes down to.
Okay.
I want to say that the statute had actually been written so that the producers had to. I think they actually wrote it so that a certain percentage of their plants had to be reserved for medical products. I may be thinking of an earlier draft of it, but I think that is ultimately where it landed, that the producers had to reserve a certain portion of their cannabis plants, especially for medical products.
Yeah, and Chris, that really is. Oh, that really is primarily if there are shortages. There is a provision that they have to have so much of their sales be for medical patients, and that was actually to ensure that a producer or a dispensary didn't just suddenly turn around and say, "Oh, we're just going to serve adult use." That they do need to actually still serve patients as well, and that's a big one. And that is one of the big questions that's come up on a regular basis. Honestly, that's about the Cannabis Control Division within RLD, about making sure at this point that there's enough supply for the medical patients, and really doing that. Now, there is a similar committee to this, although it has some other functions, that is within the Cannabis Control Division. And it is the let me see if I can remember it without just using the acronyms. The Cannabis Regulation Advisory Committee, or CRAC, the initial CRAC. And so they actually are looking at some of those items and some of those issues. And we actually had sent out an invitation to their chair, who is Emily Kaltenbach, letting her know about this meeting. But it looks like she wasn't able to attend. But I'll reach out to her again. And Martin, if you're okay with me including you on there, I'll go ahead and do that. Because they actually do have, there's, for example, some organizations that want to do some presentations and they'd like to coordinate so that they're not doing one at one place, one in another, about some of these issues and some of these things that are going on with regard to supply of cannabis.
So Dominic, you showed some interesting data in your slides. Are there going to be data collected in the recreational program that can also be compared to the medical program, or will there be no data coming in the recreational program?
I'm sorry, Haley, you kind of broke up there a little bit, but I think I got the gist of it. Asking about whether there's going to be data with regard to like sales and usage from the recreational program. And the short answer is yes. How detailed it will be, we're not quite sure yet. What I can tell you is that the program that actually tracks the sales at this current time, which, because there are not yet adult use sales, it's just the medical sales at the moment. They are able to track items such as how much cannabis is sold, price points, the types of products. So is it a flower product? Is it a lotion or an edible or other form of concentrate? And so there's actually a lot of data that is already being collected and that will continue to be collected regardless of the sale type. So that's something that, as that data starts to be collected and gathered and put into a digestible form, we will also be able to help provide it here, or have the RLD, the Regulation and Licensing Department, their cannabis control division present.
So when there is, for example, when DPS reports that they think there might be cannabis involved, say in an accident, will those kinds of information also be provided if it's recreational and medicinal, or do they not provide that now? How do we know, locally within the state, how some of this information can be aggregated in a way that's reliable and valid?
And that's a great question. And I'm not sure that DPS or the law enforcement agencies will make a distinction between medical and recreational use. So that might be something that, may need refinement further on.
There might need to be some coordination with the agencies, with the work agencies.
Right. Right. Okay. So I think I answered all of your questions there, Ryan. And I think I included the information that you had requested, Haley. Did I miss anything so far?
Oh, thank you.
Okay. Absolutely. And that's, by the way, is part of what we're here for. Ask the hard questions. We may not always have the answers. And in fact, I'll guarantee a lot of times it's like, we don't have that yet. How do we get it? So
yeah, and
we're happy
so
to
how much for this report, how much of the work is on us versus your team there? Like how much of this is going to be, hey, we really want this included. We think this research is great. We think this statistic should be included in that report. Are you guys in charge of writing that up? Or are we a committee in charge of writing that up? Where does that responsibility lie?
Well, that's a great question, Ryan, and it really doesn't define that. So what I would really say is that we will see how that develops over time. The department is, of course, responsible for putting something up. And so we will have something no matter what. I think the real question is going to be how detailed it is. What I will also tell you is the program is committed to really being able to provide the best type of data and report possible. And that includes us also going out and doing, doing research and finding out information and, trying to help with that. We may also call upon some of the committee members and or other colleagues who have access to other potential situations, such as there may be students, for example, graduate students, who are looking at doing papers with regard to this, where we could ask them for their help with regard to literature reviews and things like that, and really kind of moving forward in that way. And I see Mateo looking like, that's an idea, but and really kind of doing, going through those kinds of steps to try to get things, to try to get the data that's really needed. I hope that helps in that regard. Okay, what other questions about what the committee needs to do or potential future directions? Okay, are there other items from the committee members? I don't hear anything else. So I see Eileen had to step off, her battery was dying. And so I know she'll jump back on. But in the meantime, the next item is scheduling the next meeting. So at this point,
we just approved some guidelines that said we're going to be meeting quarterly. Is that correct, Dominic?
That is correct, at a minimum.
At a minimum.
You can always meet more often. Oh, Ryan, did you have a question?
I was just going to say, do you know, so we're going to meet at least quarterly. Did you so since we're not going to really have data at the next meeting, are you bringing like educational people in to do presentation? Like what's our purpose until we can start seeing some data or making a framework, or what are you or what does the division see as our purpose until we start collecting and having data to analyze?
So that is a great question. And what I was actually going to suggest for the next meeting, once a date was selected, is that, I can work with Martin as the chair and with Eileen as the vice chair to determine a little bit of an agenda. And that what we would probably like to do is do exactly that with some educational material. And also perhaps get someone from the Cannabis Control Division in RLD to come and talk a little bit about what their data sources and how they see things moving forward. And honestly, I think just that will probably take up an entire meeting. And I see Martin nodding his head yes, so. And I see other items about, sounds good. The other thing I would like to do is I would like to also try to have, and we will have at least some progress on the study that we're doing within the program, is have Mike or someone else from the cannabis public policy come and actually do maybe a little bit of a presentation to kind of explain what we're doing as far as our survey as part of that next meeting as well. And I see heads nodding, so this sounds good. So now we're back to date and time. Oh, Martin.
I was just going to say, if anyone does have any specific things they'd like to see us start talking about for the next agenda, just to let Eileen, Dominic, or myself know before as we're creating the agenda, that would be helpful. If you have something.
And I see Haley said meeting in perhaps 2 months for more education. So is this actually a good time, like a Wednesday afternoon at this point? Is this a good time for most of the committee members? Not for Haley. Okay.
As long as I have plenty of notice, I think I can move things around.
Okay.
Me. It is for me.
Is for Alan. So Haley is actually a request that he'd prefer a Tuesday or Thursday. So any objections to it being on a Tuesday or Thursday?
The only objection I would have would be the second Thursday in the morning is commission meeting that I have to attend.
Okay.
I'm off every Monday, Tuesday, and Wednesday, so those days are great for me.
So it sounds like Tuesdays are better.
Sounds good.
Oh, Martin, you have your hand up?
Yeah, I was just going to say that, I mean, we did get some consensus around Tuesdays, it looks like, but maybe we could do this over a doodle poll to help everyone be able to feel like they were able to put their input into what day would be best.
We could actually do that. We could set that on up again and do that through that. So is everybody in agreement as far as looking, is the time frame of 2 months sound good to everybody though? And so what we'll do is we'll look at the end of February. Does that sound good? Okay, so we will send out a Google poll in the next week or two to see what time frame will work for individuals. And we'll look at concentrating at the end of February or towards the end of February with looking at Tuesdays and potentially Thursdays, see what works best. Okay, I don't have any other items. So it really goes back to all of you. Do any of you have any other items or questions? And I see Mateo had to unfortunately run to another meeting as well.
Is there a motion to adjourn then? So moved by Hallie, thank you. Do I have a second?
Second.
Moved and seconded that we adjourn early today, all by saying aye, raising your thumbs, or sending a thumb emoji. Any further discussion or dissent? All right, everyone. Thank you very much for a great first meeting. We'll be looking for doodle polls from the program.
Thank you, everybody. We really appreciate your all being involved in this. And I will say on behalf of the program and the department, we are really looking forward to it. I think this is going to be a very interesting set of projects moving forward. And thank you all so much for your efforts. And happy holidays to everyone.
Thanks, everyone.
And Libby, you can stop recording.